Physician-led healthcare is under attack again this legislative session in scope of practice bills seeking to dismantle physician authority and boost non-physician control. This week, many physicians testified against optometrists who want to do surgery and nurses who want to practice medicine without going to medical school.
Every 2 years, groups come to the Texas legislature trying to convince you that they can do what physicians do without having done what we have done.
You know, I worry about a future where APRNs alone are prescribing independently.
TMA Council on Legislation Chair Dr. Deborah Patt joined physician leaders from several specialty societies in testifying against House Bill 2029, which would grant independent prescribing privileges to nurse practitioners.
One of the big claims of this bill is that it's going to increase access to health care, particularly for our patients in rural Texas. And while that sounds like a great idea, in practice it doesn't actually happen.
It doesn't reflect how we practice. It doesn't reflect what most nurse practitioners I personally know want. They want to work closely with their physician colleagues.
Instead of expanding APRN authority, TMA supports other ways to lower healthcare costs and expand access to care.
There's no access to care crisis when it comes to quality eye care.
Tuesday, TMA President Dr. Diana Fite and Texas Ophthalmological Association physician members urged the Senate Business and Commerce Committee to oppose Senate Bill 993, which would allow optometrists to perform eye surgeries.
I am opposed to Senate Bill 993.
Patients who testified their vision suffered under optometrists' care say only ophthalmologists should be allowed to perform surgery and prescribe certain medications. An ophthalmologist had to try to repair an optometrist's damage to this woman's eyes.
I hope that the bill would be defeated because we need them to write legislation to protect the citizens. And the optometrists are not physicians.
Dr. Fite says the bill could harm more patients like Ms. Allison. She says only ophthalmologists should perform eye surgery.
Many ophthalmologists work with optometrists. There are definite ways that can work together in a very, very good fashion and has been all along.
TMA also testified this week on other bills important to medicine.
85% of physicians report that prior authorization has led to delays in care.
TMA physician leader Dr. Zeke Silva asked the House Insurance Committee to back a bill to help reduce unnecessary prior authorization delays. The bill would require the Texas Department of Insurance to verify once a year that health plans comply with prior authorization requirements.
We view this as very much of a patient protection, a consumer protection, and when we're hearing about shortcomings of the nature I described, we feel that oversight is appropriate.
Any pregnancy and postpartum period pose the chance of illness and even death, especially without health care oversight. TMA supports House Bill 133 to extend women's Medicaid coverage to 12 months postpartum, up from the current 60 days of coverage.
It does help a lot of women.
Dr. Lisa Ollier told House Human Services Committee members why the bill is necessary.
By extending Medicaid with a more comprehensive set of services, we would be able to reach more women and address their needs.
Read Texas Medicine Today to learn if any of these bills move out of their respective committees next week.